So why do I like working at St Vincent's Private Hospital? Well, the reason that brings me here is the ethos of the hospital and also of the Sisters of Charity. I've been here a very long time, and the difference between this hospital and other hospitals around the country is the philosophy of care. It's not driven by profit, it's driven by patient care. We try and accommodate patients who come from far away in one day if possible. So we see patients from outside this region, we see them from the country, we see them from interstate and overseas. And if at all possible, we try and get them sorted out with one visit. This requires a consultation with colleagues and also a philosophy that patients are accommodated in one visit.
I believe the difference of Vincent's Private is that our community knows that not only they will receive the best available care for their condition, but that surgery will be recommended once non-operative measures have been exhausted. We have a very close-knit department of surgeons with multiple subspecialties including hip and knee surgery, shoulder and elbow surgery, and foot and ankle surgery. Patients can be assured they will have access to an expert in their field who can offer them the highest level of care.
I believe patients can feel comfortable in knowing that they will be given non-operative measures and time with a sports physician or physiotherapist, but also have access to leading surgical specialists all under the one roof. That team care approach is important to tailor treatment plans to each individual patient.
Our department carries out approximately 1,200 joint replacements every year across the St Vincent's campus, meaning our specialists are continually utilising their surgical skills, which we believe translates to better outcomes for our patients.
At St Vincent's Private, we've been pioneering minimally invasive surgery in the ankle as well as cartilage transplantation since 1996. Access to the latest surgical techniques has been complemented by the best operating theatre and ward nursing staff. These teams are specifically trained in orthopaedics, which ensures our patients receive streamlined, expert care that they deserve. Working in association with the orthopaedic surgeons are our sports physicians who have been consulting at St Vincent's Private since the Sydney Olympics in 2000.
We optimise non-operative treatment options and are involved in care of Australia's elite sporting teams, including the Rio Olympic gold medalist Australian women's rugby sevens team.
Here at St Vincent's Private, we are proud to offer the very latest proven techniques in minimally invasive surgery, computer-assisted surgery and customised hip and knee replacements.
Success rates of procedures such as total hip and total knee replacements are largely determined by patient satisfaction. For many years, we've consistently scored above 95% in self-reported patient satisfaction scores here at St Vincent's Private Hospital. Our infection rate for joint replacements is one of the lowest in Australia at 0.3%, compared with the accepted rate worldwide of 1%. This is something that we are very proud of.
We believe this is a result of doing all that is possible to avoid infection. We begin this process prior to our patients arriving to hospital through the encouragement of preoperative antiseptic showers at home. We request nose or other relevant skin swabs at pre-admission. We have closed operating rooms dedicated for orthopaedic surgery and specifically designed operating spacesuits. We employ meticulous surgical technique with minimal soft tissue trauma, control of bleeding, sealed wounds with dissolving sutures, and wound glue to minimise infection.
Our new state-of-the-art facilities include a dedicated 12-bed rehabilitation ward with single rooms and en-suites, a hydrotherapy pool and specialised gymnasium. We offer both inpatient rehabilitation and day therapy programs for patients to help achieve and optimise their health and physical independence.
Our department works closely with the rehabilitation team. This includes the rehab physicians, physiotherapists, social workers, dietitians and discharge planners, which allows us to improve the post-operative journey for the patients and optimise their recovery.
Science and clinical-based research is very important to our team of clinicians. We know that that is what will drive better clinical care and the future outcomes for our patients. The Orthopaedic Department is active in research in association with the Department of Vascular Medicine, Rheumatology, Rehabilitation, as well as the Garvan Institute for Medical Research, which is located here on the St Vincent's campus.